Public health is much more than just policy and data. It's leadership rooted in trust, science, and the ability to meet people where they are. In this panel discussion, my guests explore how to explain public health in plain language, why stigma and health equity matter, and what it really looks like to build community buy-in across very different audiences. You're listening to the PHEC podcast, episode 462. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and also trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. Now, the support that we provide often falls in the category of strategic planning, but also it falls sometimes into the category of capacity building. It just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. We'll also put links in the show notes to make it super easy. I'm very excited to introduce you to my guests on this episode. On this episode, I'm joined by 3 public health professionals with backgrounds spanning health communications, social work, medicine, and business consulting. Together, we dig into one of the most important skills in our field, explaining public health, what it actually is without the jargon. We talk about social determinants of health in plain terms, the role of trust and stigma in community health, and how to frame public health for policymakers and everyday audiences alike. If you've ever struggled to find the right words, this conversation is for you. We'll connect that conversation right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, I'm excited for our conversation. We get to really get to know each other during this time and share, thoughts. And we chatting a little bit behind stage, so I know this conversation is going to be good. This series, again, on the podcast, every now and then I like to bring a panel together and amplify voices and have a conversation about how we communicate public health in plain language. And whether you've heard the series before or this is the first time you're tuning into it, it is something that I'm very passionate about. I believe that this is a time we've always needed to do this, but now more than ever, and this is even a very important election year, it is very important for us to kind of advocate for public health in a very different way and on a new level. And for me, this is a very easy thing for all of us to accomplish, and that is how we really explain public health, what we do to our friends, family, neighbors in plain language so that they easily understand and can even get a deeper understanding through our lens, the lens that we work, our perspective. That will go a long way with getting more community buy-in to support public health, because when the community really understands it and values the work that we do and see the importance of public health, then that's more buy-in. That's collectively we're going to legislators, lawmakers. We're not willing to be easily removed. We can't let those programs go away that we know are important. So this is a part of what we do. So on this episode, in this conversation, I'm gonna have my guests introduce themselves. You can get to know them, and then I'm gonna let them share because they all have very different perspectives, and we're gonna have a conversation about what that means. Public health without like no textbook jargon is allowed in this conversation. So sometimes that's hard to do, but that's why we're working through it through this series. And so I'm going to start with Caroline. Would you please introduce yourself and tell everyone a little bit about who you are, what you do, and then we'll kind of go around from there.
Hi, I'm Caroline Waltzman. I grew up in very rural Texas. I got my undergraduate degree from Texas A&M University. I got a bachelor's of science in psychology and a certificate in applied behavioral health. From there, I went on to get a master's in health administration. And I try to use that knowledge now in public health communications in order to inform people about how the U.S. health system is structured and how they can use that knowledge to advocate for both themselves and their communities. I do a lot of talking about the importance of addressing social determinants of health, which I can kind of break apart later, I think, in the conversation as we talk about public health, because that is jargon. But right now, I currently work for a school of public health on health policy communications.
Perfect. I love that. And yes, we will definitely break that down because I think that's a term that we often throw around. So just some ways of breaking that down for people will be really good. So I look forward to dive into that. Ashika, would you like to go next?
Yes, of course. Thank you. My name is Ishita and I'm from India. I did my med school from India. Then I came here to do my dual masters in public health and social work. A lot of my research is right now focused over substance use, mental health, behavioral health, health communication, and also like disability outcomes for children in different countries. But apart from that, the very impactful, I would say, has been my work with here at the hospital at Barnes Jewish in the transplant oncology department and also the ICU conducting psychosocial assessments for and providing support for underserved people. I think this is what my current research has been about to focus on health inequities and see how that can be bridged.
Thank you. Wonderful. And looking forward to hearing from you a little bit more as well. Last but not least, Peyton, please introduce yourself.
Hi, everyone. My name is Peyton Cervoni. I grew up in rural New York, actually Watkins Glen, if anyone is familiar with it. I'm currently an MBA MPH candidate at the University at Buffalo. And my background for undergrad was in something called sociomedical sciences, which really just focuses on how social structures impact physical health. Currently, I'm working as a communications slash operations consultant for certain health organizations in Buffalo, including Kaleida Health, Kankit Biotech Pharma, and the School of Public Health Dean's Office. And I also have some experience in community health and social work. And I really love to advocate for the balance between health needs, business goals, and how policy can really impact all of that. And I love health communications, and I love strategically understanding perspectives that have the most impactful health outcomes.
See, this is why I'm excited about this conversation. Thank you all for those wonderful introductions. And this is a relaxed conversation. I know that we will enjoy the conversation, and I know that I always think about the listeners of the podcast episode, and I think they will also enjoy this. I think this is one of those opportunities for us to relax a little bit in what we do. And as we're brainstorming and having this insight, sharing insights back and forth, those listening can also experience that and gain from that. And also toward the end, I'll share with everyone how to connect to the show notes page, which is where we'll have links to our guests if you would like to connect with them through LinkedIn and, continue to communicate and share thoughts, so forth. I encourage you to do all of that. So my question to all of you, when you're in whatever the setting is, and you can, put the context into as you begin to speak, but I really want to know, how are you explaining public health? When someone says, what is public health? How do you explain that in plain language? This may be to colleagues across departments. It may be to a group of kids or a group of elderly members like you, paint the picture for us. But really, how are you explaining in plain language so that people understand what public health is? And we'll go in the same order. I'll start with you, Carolyn, if you could just, share your insights on that.
Sure. So I am currently doing public health communication. So my audience is generally quite, the typical lay person, I guess you would think, a general, maybe not a high health literacy level, may not be super familiar with the idea of public health or our health system. But I usually explain public health as using data to help us make health policy to create the conditions for people and our communities to be healthy before something terrible happens, right? Protecting people, it's preventative. I think a lot of people hear the health piece of public health and immediately maybe assume hospitals and, other direct healthcare access type things. But while healthcare access is definitely a big part of public health, I also explain it as, clean water, access to maternal health care, vaccines, safe housing, transportation, having access to education. I think that's a lot of privilege and maybe not having access to a high quality education where you live and the systems that mold whether people end up thriving in their communities.
Now, does that usually get any follow-up questions after you say that? Or are they just like, oh, okay?
I do get questions. Usually they're related to what health policy really is. And right now, I think we are seeing a lot of confusing messaging. And the way I try to explain it is using as much evidence based information that I have to help inform them about what they're directly asking about. A lot of it does come more down to the science questions and how we would go about improving, access to education and, access to vaccines, especially in those underserved communities around the United States, because everybody does come from different pockets. My background, being a military spouse, I've lived in very rural Alaska. I've lived in very rural Texas. I'm in a suburban area of Georgia, and I will be in a very urban area of Hawaii next month. So I see those pockets of culture, and it has to be addressed differently across the board. And those are usually the questions are more specific to, I guess, the cultural context that those folks are experiencing.
I like that because it reminds me of, I say something similar, evidence-based. I want people to understand that I'm not telling you what to do. What I'm explaining or expressing is based on what the data showing evidence, right? So that we're kind of debunking a lot of the misinformation that's flowing around. So this is not on conspiracy theories, but based on factual information so that communities can make their decisions. They can make decisions for themselves. But my goal is I want them to make those decisions based off facts and not confusion or misinformation. So I like that. You're right. There's a lot of cultural nuance, and we'll probably come back to that again. I'm going to move over to Issa. How are you explaining public health when people ask?
So I'm from a very medical background and my parents are doctors too. So I grew up in a kind of a culture that was extremely like medicine based, like going to the hospitals and like seeing patients and treatments and medicines and everything. And public health was really new to me as well. But when I think about it, I believe that our health isn't defined by, doctors or medicines, but it's also like shaped by our lives, the neighborhoods we grew up in, the communities that we are part of, the opportunities we have, the people around us, and the conditions we're living in. I love how Caroline mentioned like she uses data, and I'm also a very big data person, but I cannot leave behind the fact that while using data, I also have to think about the lived realities of the people that I'm working with. I have to take those into account as well, like the conditions. If I am like working in something called like the substance use research or like cancer outcomes, it's very easy to think of it in very individual terms, like, oh, these might be like choices made by people or like some behaviors led to that illness. But that I want to explain that that is only a small part of the story. And if we look through a public health lens, the question shifts. And I'm recently taking like a substance use disorders treatment class. So one question that definitely comes up every time the professor is teaching is like, why did this person use substance? Like, what were the conditions around them? And because this doesn't happen in a vacuum, and those same conditions, same pressures, they're also like affecting cancer outcomes. So when I start to see the overlap, I also tend to like explain that to people. Like, it's not just about preventing diseases. We have to like pay attention to what people are living through. We have to like recognize that health is tied to things like safety, dignity, stability, whether someone feels that they're belonging to this community or not. It's about asking like why communities are constantly carrying more burden than the others, and like how our health globally is also being shaped by like social, economic, or political forces.
Thank you for that. And I think that it reminds me a little earlier when we touched on social determinants of health. I think you just described it without even using the phrase, right? Wonderful, wonderful. I'm going to keep going, but I know Carolyn might have some thoughts on that. But hold on, because I want to give Peyton a chance to respond. But I'm definitely going to come back to you. Peyton, please answer the question for us. How do you explain public health to friends, family, neighbors, friends without using jargon?
Of course. So, honestly, it's been so hard to answer this question, and when it was brought up to me, it actually was this perfect timing because I just finished taking a corporate social responsibility and ethics class, and my professor is actually studying servant leadership. That is his discipline. He lives by it, breathes by it. And he was always this sort of tongue in cheek guy. But despite all the humor, that day when I was invited, we had talked about definitions of leadership. And his favorite definition came from Dwight D. Eisenhower, and it went, leadership is getting people to do what you want them to do because they want to do it. But then he went on and he added this amazing line with his own twist. It was, and it's helping them to accomplish things they didn't know they were capable of. And I really felt that this encapsulated what public health is. By nature, we are servant leaders, and our work is rooted in service. We are recognizing what is best for these communities, and we are guiding people towards healthier, safer lives, not through force, but through trust and partnerships and a shared mission and goal of helping everybody. And public health leadership isn't that authority that I think a lot of people are really worried about nowadays. It's really grounded in integrity and that evidence base. But we are the gatekeepers. We understand that deep evidence. But then how are we going forward and sharing this as leaders? How are we getting people to understand that? And I think in my experience, public health has really focused on that technical expertise. I even think back to the COVID-19 pandemic, and it often lacks that ability to tell a really impactful story. And we sit in this beautiful intersection of science, research, and data, but that is not what moves people to listen to us. We are dealing with that information asymmetry where we understand that, but our people don't. And while our populations, they may not understand our goals, our intentions, or even why this matters, but that's why it's so important for us as leaders to bridge the gap. It's our responsibility to, meet people where they are and explain, give some background on why we're doing this that is in their language and how they are going to understand and see it. And I've seen this in multiple different ways. And I mentioned earlier, I do consulting. Well, I'm working with a healthcare system on doing research why they should implement or keep an acute care surgery model because the data clearly shows benefits. However, my team and I were talking to C suite professionals, top of the line business people who are running this company or this system. And we need to frame this in a different way than I would with people in public health who understand it. We have to think about the efficiency, fiscal responsibility, and long term sustainability on top of also what's the impact we can have on the community. And even in social work, one thing I dealt with a lot was taking information. My favorite was always sharing vaccine information and, presenting it in a non biased way that does not push the family to make that decision, but you're laying out the evidence in a way in which they will understand it. How does this work in their daily lives? What is this going to protect them from? What is the benefit? And hearing their concerns and addressing them one by one, but it's all about changing that narrative based on the perspective you're dealing with. And I think history really reinforces that. I mean, I loved when Caroline mentioned all these beautiful innovations we have. such as my favorite is always the toilet. I think sanitation is amazing, but these succeeded because people bought into them and they saw the value in that. And especially today, there's not a lot of trust. It's very fragile. I'm from rural New York, and distrust in medicine is everywhere. It's in my family, friends, my connections, and it's a really polarized time. However, I feel like public health finds itself at the center of all this tension, and it's easy to feel frustrated, especially when people don't understand that. And I feel that frustration too. But the leadership we are doing, it demands us to pause, to push aside biases and ask the harder question of why are people thinking this way? It is the curiosity that allows us to make progress in our field. And someone once said, you can just throw some information at people. You need to get vaccinated, but that's not going to be what makes people listen. It's when you connect with them and their emotional side that you're going to see people enjoy the value of these things that we're doing. And I think it's really difficult for even me to reach across the aisle and say, hey, I want to work together. But as leaders, that is our responsibility to bring everyone together. Because one thing I find so beautiful about public health is that it's for everybody. It's looking at the wellness of everyone. It's a holistic picture considering what are all the contexts, all the perspectives, all the experiences that led to this point. And I think that there's a lot of pride that comes from this work that is unseen, it's underpaid, it's underappreciated because that impact is invisible and that is our responsibility to change these lives in the background. But it's the ability to keep pushing forward even when the world pushes back and to hold on to the hope for a better tomorrow and to help others see that too. And I really think in the fullest sense public health is leadership.
Thank you for that. That is really well said. And I think you really brought up all of the things that we need to really be considering, who we're speaking to. Everything you said was spot on. And I do like that seeing public health as leadership because we all are, leaders in this space. Whomever we're speaking to, we're very passionate about the communities we serve. And we're really thinking of their well-being. We're very proactive as, we're prevention and proactively, looking at this. So we are leaders, regardless of whatever letters fall behind your name and the status that you're as with your employer. But we are leaders when it comes to our community. So really thinking about how we communicate and explain public health through the lens of a leader. That's really important. I like that. I definitely want to come back to this plain language context. I love where we were going with and Peyton, think about this because I'm going to ask you too. But I'd love to know, Carolyn, your thoughts on how Isha talked about, really basically explain social determinants of health without saying social determinants of health. I'd love to, what are your thoughts on that? If you have anything else to add to that whole kind of context, that's a great example of how we can kind of attack some of the jargon.
So when Ashita was talking, I thought it was an amazing description of both social determinants of health and the importance of health equity and what that really looks like whenever we're talking about, I guess, whenever I have people asking me, what is a social determinant of health? I say, okay, well, if you're thinking about it as a river, the upstream factors are things that dirty water, not having access to clean air. Those are things that if we acknowledge them and see them and have the data on them, we can fix and prevent and really try to use that information to make all of the more privileged experiences that many people face more equal across the board. We can make it more equitable before those things maybe potentially flow down and create problems for generations to come. And we see that, the cycle of poverty, and we can really start going down the rabbit hole. But I really thought her description was amazing about the importance of making sure that health access in the United States is more equitable and how that really is, I think, the future of public health.
Yeah, that's a very, very good point. Yeah, she did touch very well on equity. Peyton, what are your thoughts on that?
Yeah, of course. And one, I have not heard the metaphor of the river in so long. And when you brought that up, it made me so happy. I also think about it as like you might live next to somebody, your neighbor, who looks exactly like you. However, your lives, your health is completely different. And it's understanding the experiences, how somebody grew up, their identity, their race, how all of these impact how your health manifests, how you are. And it's just seeing that variety of how people can be in the same place, same economic status, same race, same, sexual identity, but everybody has such a different story. And that's what I think of for social determinants of health and how somebody's impact with poor sanitation, lack of education, how that spills into how you take care of yourself and others. And I thought everybody did a fantastic job. I always think when it comes to health equity, it's meeting people where they need it. It's not giving everybody the same thing. It's understanding that people need different things to be equally as successful and that it's not a level playing field. Some people really are experiencing those different social determinants of health that impact them in different ways, and they might need a little more help than everybody or other groups of people. And it's really being mindful of those differences and then giving the adequate amount of care that is needed to make up the difference.
Sheila, we've been really rallying around you. Do you have any other thoughts you want to share on that?
I think it's amazing how Caroline and Peyton have, come up with to explain like the social determinants of health through different environmental stuff and how you came up with like the sanitation thing, which I felt like was a big problem, or I would say a big public health issue back in India where I was working because it was an underserved area, a rural area, and sanitation is one of our main concerns there. So I just thought about how we are like caring enough to look beyond the surface to understand what conditions people are living in and to work towards. This might be like too big to say, but like work towards a world where those realities don't make it harder for the people to be healthy if they're living in certain conditions. That's what I've been thinking until now, and I feel like there's something that I wanted to add that is extremely a big part of public health back in India, and it's like the stigma, like the real barrier that comes to care. I feel like sometimes the biggest barrier isn't the disease or like the condition. It's more like how people are treated when they show up for care, and how we can talk more about stigma and how that makes up for like the delayed care, dropping out of any treatment, feeling unsafe in like healthcare spaces, and how that has like actually turned around the trust in healthcare systems or actually in public health.
It's an excellent point. Excellent point. I think in this conversation, this short period of time, we've highlighted several things that, we've broken some barriers. We have some language to describe several issues without the jargon. And we've highlighted, some real points to consider, the servant leader perspective, stigma, absolutely, in addition to the language and the communication and the perspective of the people that we're serving. I think one of the things that I've always been, since I've started the podcast, it's been fascinating to me to get to know each of my guests. So if you listen to the podcast for any length of time, every single time I get ready to introduce my guest, I'll say, I'm so excited to introduce my guest on this episode. And I absolutely mean it. Like, it never gets old for me. There is so much diversity in our field, and I genuinely enjoy learning about everyone's paths and their journeys. And I think that if we take that enthusiasm, into our work, it doesn't get old. There's always going to be, like I think Peyton was saying, everyone's experience is completely different. So if I interview 10 epidemiologists, I'm going to get 10 completely different stories. I ask similar questions in each episode because it helps me guide the conversation and sift out, but I get a completely different response every time. So I think that's something we can take into like approaching the communication around what public health is. I had a colleague that, where I'm chatting about this and she's loving the concept of this on the podcast, and she kind of took it one step up and she's policy and advocacy. So she's like, how do we take these conversations, like similar to the things that we're talking about today and like the takeaways, into spaces where we're talking with policymakers and our, legislators and have these conversations in spaces like that? Because usually they're not public health trained, and they may or may not understand some of the things that we are advocating for and things that are needed. So if we can, like, next level, for some people it's like, oh, absolutely not. And I get it. But for some people, like, hadn't thought about that. But I think that could go a long way. I've started doing that myself. And I think that those are some of the ways, like, so many things we talk about today are things that we can kind of take and have those conversations. So I'm gonna ask, curious, what you guys, your reaction or thought around that is. We'll start with you, Carolyn.
I think a lot of what I do is both informing people on what health policy is, but also encouraging them to advocate for themselves in their communities. And that includes writing their representatives most of the time about issues that are coming out that people may or may not realize really do have an impact on them at the very bottom level of the pyramid, right?
Right.
And when they feel empowered and, knowledgeable about those issues, they do feel more like they have a voice.
Yeah.
And I think that that is definitely the direction we need to move. I think that is how another way, on top of us maybe going in and speaking directly to them, it is really great to see people on the ground and feeling that empowerment to go out and start really having those discussions with their representatives, people who are supposed to be advocating on their behalf.
Absolutely. What about you, Ishta? What do you think about that?
I think this is a very beautiful thought because I think this is when the real change starts to happen. It's not just about giving the information. I'll just go off what Caroline said about like knowledge, how people, if they're empowered and knowledgeable, how it can make a difference. It's about making that information accessible, relevant, and actually usable in someone's life. And like how we use like general words for regular words to explain public health and not some jargon. This is something that empowers me as well as a future public health professional to be, able to, people understand, feel supported, feel seen so that they engage more, ask more questions, and also make decisions that are actually working for them. And in a very strong way, public health is definitely about policies and programs, but it's also like about the people who are informed, people who feel like they have some agency, people who are treated as partners in their own care. Because at the end of the day, we can only go as far as the trust and empowerment that people actually feel.
Yeah, that's really well said. And Peyton.
Yes, I think this question perfectly touches on what I had mentioned and just being open to that curiosity and not always just telling, but also hearing and listening and understanding where people are coming from. I think some of the first questions I always like to ask is, what is holding you back from this? Is it money? Do you not understand the benefit of this? How this can help not only you but everyone else? And taking that and then framing the benefit. I think of something like, I used vaccines as an example earlier. Some might be more driven by the fact that it prevents harm. It helps you avoid getting hurt or getting really sick. Whereas some are more motivated by the liberty to choose if they can get a vaccine or not. And when you understand the kind of moral ground in which people are standing on, especially thinking about politics and how deeply public health is impacted by that, when you understand what different groups of people are motivated by, that is where you can find your sweet spot for policies because then, you might be talking about the same policy, but people have different perspectives on it and building in all of these are benefits of it. This is all something we can benefit from, but highlighting strategically the parts that certain people are going to respond to. And I think it's a really big challenge right now. I think there's, a lot both sides where it's hard to acknowledge that someone can think differently than you and not be attacking you. But when we can do that, that's where we're gonna find that we're gonna rally the most support and have the most impact in health policy.
Spot on. Well said. Thank you all so much. I'm going to need to wrap up because I'm trying to be mindful of time. I told you all this was going to be a great conversation. I knew it coming in. But I thank you, each of you, for taking time for joining me on this conversation, for sharing your insights. And yeah, we're definitely going to keep in touch because I feel like there's more to continue to discuss. But thank you all for being here. Really appreciate you.
Thank you for this wonderful opportunity. It was great to catch up with some great public health minded people and just share some thoughts. It was a great conversation.
Thank you.
I really hope you enjoyed that conversation as much as we did. What stuck with me the most about this conversation is how naturally these three voices came together around a shared truth. Public health works when people feel seen, informed, and empowered. Whether you're talking to a neighbor, a legislator, or a C-suite executive, the goal is the same. Lead with curiosity, meet people where they are, and trust that clear, honest communication builds the kind of trust our communities need. That's the work. And every one of us in this field is capable of doing it. So I encourage you to connect with Peyton, Ishita, and Caroline and learn more about the work that they're doing and just connect with them further on anything that resonated with you from this conversation. You can find the links to connect with them on the show notes page. The show notes page for this episode, which is episode 462, can be found at phecpodcast.com. Now, once you're there, just navigate to episode 462 to find the show notes. Before we go, I want you to remember that our podcast has an app and private community that is independent of social media platforms, where you can engage with public health professionals around the world. Now, in addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download our PHEC podcast community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone, until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.